As you know, nurses and doctors are working round the clock to treat people infected with COVID-19. New York is being called the epicenter of the country's coronavirus outbreak, and healthcare workers from all over the nation are traveling there to help on the front line. KINT News 3's Kaylin Thompson is keeping in touch with one Minnesota nurse who answered that call and joins us live. Kaylin.
George, even though there are more than 300 coronavirus cases in Olmsted County alone, Mayo Clinic in Rochester is a lot quieter than hospitals in New York City. And that's why some nurses decided to go there to help instead of staying here. At the end of March, I introduced you to Liz Schaefer, a nurse from Minnesota who went to go help in New York. She's already been there a month and tells me she started working in an emergency room and then got moved to working in the intensive care unit. She says 99% of the patients there are hooked up to ventilators. She describes it as a very emotional experience and stresses that we all have a responsibility to protect one another. For her fellow Minnesotans, she has a message.
People really need to take a step back in Minnesota and be thankful and gracious and find some humility right now that they have a governor that stepped up to the plate early on and shut this down when he did.
Schaefer tells me she's contracted to be out there for about 13 weeks, so she's about a third of the way done. When I asked her if she would extend that contract, she tells me when she's done in Minnesota is probably when she'll be most needed here in Minnesota. Live in Rochester, Kaylin Thompson, KINT News 3.
Thanks, Kaylin. Now, Schaefer tells us she is contracted to work about 48 hours a week, but she's actually working up to 90.
Happening right now, Rochester City Council members are discussing what to do about the coronavirus